Good afternoon, everyone. My name is Rhonda, and I am a project specialist with Quirk Healthcare Solutions. And I wanted to thank you for joining me today for today's Insights presentation. The purpose of today's presentation is to give an overview of the value-based payment modifier and how it relates to the PQRS program. Also, how the value-based modifier program can affect physician Medicare reimbursement starting in 2015. Many of us are very familiar with programs like Meaningful Use and PQRS. We often talk about these amongst healthcare professionals, and we're very aware of how these programs work and how they can affect the providers financially. The value-based modifier program is a little less widely discussed, and most practitioners really know very little about how the program works or how it can affect them financially, both in an upward adjustment as well as a downward adjustment payment. So we're going to be taking a look today at a few different things. We're going to look at the overview of, exactly what is the value modifier program. We're going to talk about the distinction between Medicare physicians and eligible professionals, relationship to other quality program initiatives and payment adjustments, the 50% threshold option, quality and cost measures, quality tiering, and I'm also going to review with you a decision tree that will help some providers know whether they have to participate in the value modifier program and what are the ins and outs of participating versus not participating. So the first thing we're going to look at is, exactly what is the value-based modifier? Well, the value-based payment modifier program is part of the Affordable Health Care Act. It does measure both the quality of care and the costs associated with that care by Medicare physicians. CMS has taken a rather phased-in approach to the value modifier program. So during this presentation, we're going to mainly focus on the 2016 value-based modifier program. But I do want to kind of talk to you a little bit about how the program started in 2013. So basically what's happening is there are three phase-ins to this program. The first phase-in is based on groups of 100 or more providers. And that group was phased in beginning in 2013 for the value-based modifier program in 2015. So those of you that are familiar with PQRS, you understand that PQRS is on a 2-year rollback. So what that just basically means is that in 2013, the measures that you're reporting for PQRS are what will be used to determine whether you have met the value-based modifier and how that will affect your payments in 2015. So groups of 100 or more eligible professionals have already been participating in the program. They started in 2013 collecting their PQRS quality measures and will be determined as to how that will affect their value modifier in 2015. The second group would be physicians with 10 or more eligible professionals. This group would be eligible for the value-based modifier program starting in 2016. But that simply means that the measures that they are reporting on in 2014 are what will determine their value-based modifier payment or adjustment in the year 2016. So again, we are on a 2-year rollback. So you have to think about what you're doing right now and how that will affect you in the year 2016. The last phase of this is to be completed by 2017, and that would be all individual providers as well as groups of 2 through 9. And those providers will begin participating in PQRS reporting for value-based modifier in 2015, and they will know their adjustment for the year 2017. Now, of course, those guidelines have not been published yet, but we do anticipate that they will follow the current method of payment for that. So I want to just reiterate that implementation or participation in the value modifier program is based on participation in the PQRS reporting. So if you do not report in PQRS, then you are not eligible to participate in the value modifier program. So we'll be discussing that a little bit more in detail. So what determines, one of the things that we just talked about was groups of 100 or more, groups of 10 or more, and groups of 2 through 9. So one of the things that's important to understand is what determines how big your group is. So I wanted to show you a listing of eligible professionals. So that's how it is determined what size your group is, by how many eligible professionals are within your group that are sharing the same tax identification number. So an eligible professional can be anyone that's listed in the first column in my table here. So it can be Medicare physicians, it can be a MD, a DO, a doctor of podiatric medicine, a doctor of optometry, a doctor of oral surgery, a doctor of dental medicine, or a doctor of chiropractic. Other eligible professionals that would fall into this category would be non-physician practitioners, such as a physician's assistant, a nurse practitioner, a registered dietitian, a physical therapist, or a qualified speech language professional. So if they are sharing the same tax ID number, they would become part of a group. So you may have a group of 5 MDs and then an additional 10 non-provider practitioners, but if they all share the same tax identification number, you would have a group of 15 eligible providers. So that's how the group number is determined. Now, one of the important things to remember is that eligible professionals form the group. However, not all eligible professionals within that group are eligible to participate in the value modifier program. So you can see from my grid, what I did was I wanted to tell you, out of the eligible professionals, what do they qualify for? So you can see that everyone that I've listed here that's an eligible provider, aside from a certified registered nurse, qualifies for the PQRS program. So what that just simply means that anybody on this list is eligible for a PQRS incentive, and they are also subject to a PQRS adjustment. So anyone that's on this list of eligible professionals should be participating in the PQRS program. If they are not participating in the PQRS program, they are going to be subject to a penalty. Now, here's the confusing part. So all of these eligible professionals are included in the definition of a group. However, just because they're included in the group does not mean that they will be included in the value modifier program. So they are included in the group to calculate the number of eligible professionals within the group, but they are not subject to the value modifier payment adjustment. So that's why you see I have nothing selected here. I did want to just include in this slide as well is that these providers, non-provider practitioners, are only eligible, a few are only eligible for the Medicaid EHR meaningful use incentive. So you can see that none of these eligible providers are eligible to participate in the meaningful use incentive program. So we just talked about how a group practice is defined. It's defined on the size of the group is determined by how many eligible professionals share the same tax identification number, and it does have to be 2 or more eligible professionals. So again, the eligible professionals make up the group, but only physicians are subject to the value modifier. So only physicians such as MDs, DOs, doctors of optometry, chiropractors, anybody on this list will be subject to the value modifier payment adjustment. So how does the value modifier work in relation to other quality programs? So the first chart that you're going to see here basically what I've tried to do was just show you now remember these are all physicians that are eligible for the value modifier program. So I just kind of wanted to show you, and this slide is very important because I think it tells you exactly what happened, what is the downside to not participating in these incentive programs. So the first column is your PQRS program. So any of these providers that are participating in PQRS in 2014 would be eligible to receive an incentive payment of 0.5% towards their Medicare fee-for-service. And that is, of course, if they meet the standard, if they successfully report and meet the standard for PQRS. I will not be talking in depth about the PQRS requirements, but basically it's reporting on 9 measures across 3 domains at 50%. So if you are successful in that, you are eligible for a 0.5% increase. If you do not participate in PQRS, you will automatically receive a 2% downward adjustment on your Medicare fee-for-service. So not participating and/or participating and not being successful, you will receive a 2% downward adjustment in your Medicare fee-for-service. So the second thing to look at is the value modifier. Value modifier is tied directly to your PQRS reporting. We're going to talk a little bit later about how the value modifier is calculated, but one of the items is on quality of care. So the quality of care comes from the PQRS reporting. So remember we talked about 100 or more eligible professionals began their quality reporting back in 2013. So they have a little bit of a different value modifier adjustment for the year 2016. So if their PQRS reporting and their value modifier cost reporting is successful, they can receive an upward adjustment of +2 or +1. Or they could simply be neutral. Neutral just means that they've done the value modifier and they reported it successfully, but they were on the average mean for the United States, and so they would not be above the average mean and would not receive an upward adjustment. If they choose not to participate in PQRS, or they do not meet the PQRS reporting standards, and another slide I'm going to show you is quality tiering, but if their cost is elevated and their quality is low, then they could be subject to a 1% or 2% reduction in their Medicare fee-for-service. Now, one thing to keep in mind is if they do not report on PQRS, it's automatically going to be 2%. So the reason that this is so important is because remember, if you do not report on PQRS, you will receive a 2% Medicare fee-for-service downward adjustment for PQRS. But then another 2% value modifier downward adjustment. So right away, you're looking at a 4% downward adjustment on your Medicare fee-for-service simply for not reporting PQRS. So if you take nothing away from this presentation today, it's important to understand that PQRS is tied directly to the value modifier, and both of those are subject to a downward adjustment. Not reporting on PQRS would cause you to have a 4% downward adjustment on your Medicare fee-for-service. So providers in the second phase-in of 10 through 99, this year they will not be subject to the downward adjustment that providers of 100 or more would be. They would only simply be subjected to either an upward adjustment for successful reporting, or they would stay neutral. However, they would still be subject to the 2% Medicare fee-for-service adjustment for not reporting PQRS. And lastly, I added to this screen as well is the EHR incentive program. So the reason I added this slide is just because I wanted to again, just say that if you are deciding not to participate in any of these programs across the board, you could potentially receive a 2% penalty in your Medicare for not meeting the meaningful use requirements. So across the board in 2016, you could have a 6% reduction in your Medicare payments for the 3 incentive programs together. This slide will just show you again that these are non-physician practitioners who qualify for PQRS. They do not qualify for the value modifier program, although they are included in the determination of the group size, but they do not qualify for the value modifier. Some of these providers do qualify for a Medicaid meaningful use, but not the Medicare meaningful use. This slide will show you the policies for 2015 and 2016. Again, I just want to remind you that we are on a 2-year look-back period. So anything from 2013 becomes effective in 2015. 2014 becomes effective in 2016. So we have 2 different sizes. We have 100 plus or we have 10 plus. Available quality reporting mechanisms this year are GPRO web interface, but that must be groups of 25 or more eligible professionals, CMS qualified registry, a certified electronic health record vendor, and then also the 50% threshold, which we will talk about. What are the components? Now, this is the quality measure part. So outcome measures. The performance on the outcome measures and measures reported through PQRS will be used to calculate a quality composite score for the group for the value modifier. So again, if you are not participating in PQRS, there will be no quality measures to report on, so you will not qualify for the value modifier. So for 2015, they're using all-cause readmission, composite scores of acute preventive quality indicators such as bacterial pneumonia, urinary tract infection, dehydration, composite of chronic prevention, as well as quality indicators for 4 chronic conditions, COPD, heart failure, and diabetes. These are all the same this year that they were last year. There's also something called patient experience care measures. They did include that this year, but it is only an option for groups of 25 or more eligible professionals. It is required for groups of 100 or more eligible professionals that are reporting via the web interface. So if you are reporting using the GPRO web interface and you have 100 or more, then you are required to do the patient experience care measures. This slide shows us the components used to calculate the cost portion of the value modifier. Now, one thing that I would like to stress on this is, unlike the slide prior where it is related to the quality measures and the practice is responsible for reporting the quality measures to CMS, the cost measures are completely calculated by CMS. So nothing is done at the practice level to report to CMS for the cost measures. This is all done through claim submission, and this is all calculated through CMS. So the second part of the value modifier policies is the cost measures. And in 2015, the cost measures were based on total per capita costs for annual payment standardized and risk adjustment for Part A and Part B. It does not include Part B costs. It's also based on the total per capita cost for beneficiaries with 4 chronic conditions: COPD, heart failure, coronary artery disease, and diabetes. The measures for 2015, again, remember that's reporting, the measures for 2016, again, that's starting to the reporting for this year, are the same as 2015, but they've also added an additional cost measure. And this is the Medicare spending per beneficiary for the cost of a hospitalization. So this would be what is the cost for a Medicare A and B beneficiary for the 3 days prior to a hospitalization and the 30 days after a hospitalization. So basically what they're looking at is the care that's provided to the patient to try and prevent a hospitalization. What are the benchmarks? It's a group comparison, and it's also specialty adjusted. Quality tiering in 2015 was optional, but in 2016 it's mandatory. Groups of 10 through 99 can only receive an upward or neutral adjustment, no downward adjustment. However, groups of 100 or more could potentially receive an upward, downward, or a neutral adjustment. The payment that is at risk for 2016 increased from 1% to 2%. Groups with 10 or more may select one of the following PQRS G-Pro quality reporting mechanisms and meet the criteria for 2016 PQRS payment. You can do a G-Pro web interface, a G-Pro using CMS qualified registry, or a G-Pro using electronic health record. This year, they have also included something that's called the 50% threshold. So what is the 50% threshold, and why would an eligible provider determine to use this versus reporting as a G-Pro? One of the most common reasons that a practice would choose to do this would be if they have multiple specialties, which would make it difficult to come up with quality measures that everyone in the multiple specialties would adhere to. So a wide specialty mix could cause difficulty finding common quality measures. And this would be one of the reasons that providers would continue to report PQRS measures individually. So if a group does not seek to report quality measures as a group, CMS will calculate a group quality score if at least 50% of the eligible professionals within the group report measures individually. So at least 50% of the eligible professionals must successfully avoid the 2016 PQRS payment adjustment. Eligible professionals may report on measures available to individual EPs via the following reporting mechanisms: claims, CMS certified registries, electronic health record, or clinical data registries. Providers or eligible professionals that are looking to simply avoid a PQRS penalty can simply report on 3 measures at 50% successfully, and this will help them avoid the PQRS measure. So how will CMS determine whether a group of physicians has 10 or more? So I've already told you the formula for calculating how many providers you have in your group. But CMS will run an official query on the PACO system, and this will allow them to identify groups of physicians with 10 or more eligible professionals as of October 15th. So they'll generate a list of potential groups that could be subject to the value modifier. And then at the end of February, when all of the PQRS measures should be submitted through registries or web interfaces, they will again evaluate and remove any groups from the list that did not have 10 or more eligible professionals that billed under the group's tax identification number. So groups will not be added to the October PACOS list after that query. So if you have a group right now of 6 eligible professionals that are all using the same tax identification number, and in October, PACO's system is queried and it shows that your group is sharing 6 people are sharing the same tax identification number, they would not be considered eligible for the value modifier program. And then in December, you add 5 additional providers to your group, all using the same tax identification number. technically you would now have a group of 11 because you're all sharing the same tax identification number. However, the query has already been completed. It was completed in October and will not be repeated. So therefore, that your practice that added those additional providers would not be subject to the value modifier program because they were not a practice of that size prior to October. So now we're going to take a look at quality and cost measures. So I mentioned at the beginning of the program that the value modifier program is based on the quality of care and the cost that it takes to provide that quality of care. So what cost measures will be used for the quality tiering? Again, it's total per capita costs for your Parts A and Part B. It's also the total per capita cost for beneficiaries with 4 chronic conditions: COPD, heart failure, CAD, and diabetes. Medicare spending per beneficiary measures for 3 days prior to and 30 days after an inpatient hospitalization will also be calculated into the quality tiering. All cost measures are payment standardized and risk adjustment. So basically what that means is if you live in an area with higher Medicare costs, so let's say in California, you live in California and you provide care in California, and Medicare reimbursement is higher than what it is in Ohio, that cost is actually standardized. So you are not going to be penalized because it costs you more to provide care for someone with CAD in California than it costs to provide care to someone with CAD in Ohio. So they actually take that and they standardize that cost across the board so that you're looking at apples and apples. And then also each group cost measures are adjusted for specialty mix. So again, that just simply means that if you have in your practice, let's say an orthopedic surgeon, where the cost of care is higher than a family practitioner, that is adjusted per the specialty mix in your group. So they are truly comparing apples and apples instead of just comparing the groups to the groups. The cost measure, again, it's done based on 5 total per capita cost measures. Beneficiaries who have had at least 1 primary care service rendered by a physician in the group. And then it's followed by a 2-step assignment process. It's beneficiaries who have a plurality of primary care services rendered by primary care physicians. Beneficiaries that remain unassigned who have received plurality of primary care services rendered by any eligible professional. So a lot of the talk about this value modifier is kind of based around primary care physicians, which in actuality, that's because primary care physicians are the ones that are doing the health maintenance versus, a specialty like orthopedics or general surgery. Patients will see them in, for acute care. Sometimes, routine care, but the items that we're looking at for chronic conditions, again, remember, are things like diabetes and coronary artery disease. So they will take that all into consideration and pull all of that data into your group practice costs per Medicare beneficiary. So quality tiering is basically how they determine the cost, the quality of care and the cost of care. And this is a good slide to just kind of show you. It's based on 2 composite scores. The first composite score is based on your PQRS reporting. Again, remember, so if you do not do PQRS reporting, you will not qualify for value modifier. So for PQRS reporting, you are going to be reporting measures based off of 6 different domains. Each of these domains is given some composite scores. So based on what you choose to report on, your composite score will be based off of that and how successful you are on reporting that quality of measure. The second part of the tiering is based on the per capita cost. And then again, it's based on the per capita cost as well as the per capita cost with beneficiaries with those specific chronic conditions that we discussed. And then those two scores are calculated together to come up with your value modifier score. So this slide basically shows you the quality tiering approach. Each group receives the two composite scores. One is quality of care, the other is the cost of the care, and based on the group's standardized performance and how far away from the national mean they are. And then group cost measures are adjusted again for specialty composition of the group. So looking at this screen, you would want to be in high quality and low cost. So if you are 2% of the mean of the national mean, then you are eligible for an upward modification on your Medicare fee-for-service of plus 2%. Now, why does it say plus 2? Where if I were to look at low quality and high cost, it says minus 2. So you can see that the plus 2x, and this is just simply because the upward payment is based on a budget. So basically what's going to happen is in 2016, after all the value modifiers are calculated, they will have a budget available. And that budget is based on people that are going to receive downward adjustments. So all of those downward adjustments will go into, if you will, it'll go into a pot, and they'll say, okay, this is the amount of money that we have to distribute for the upward adjustment. So until the value modifiers are all calculated, it's difficult for them for CMS to report exactly what your upward adjustment will be. But they can tell you that if you do not meet the national mean, that if you're below 1 on the national mean, which would mean low quality and high cost, you would receive a 2% penalty. So it's kind of a how they calculate it. There is a formula, but you can kind of understand that it's based on those two things. So reporting of the PQRS measures is very important in this composite. So downward value modifier payment adjustment in 2016. So I want you to understand that the payment adjustment is applied to Medicare paid amounts and services billed under the physician fee schedule. So it's not based on what you charge. It's based on what CMS reimburses. So for 9921212, you might charge $100, but Medicare only allows $50. So your reimbursement is $50 on that. So that is where the adjustment comes from. It does not come from what you charge. It comes from what you are reimbursed. It does not affect the Medicare benefit. It does not affect the beneficiary's deductible, so you can still collect the same amount of deductible. You're not taking a percentage off the deductible. It just strictly comes from the services billed under the physician fee schedule. Again, it does not affect all of the eligible providers that are calculated into the group, just the physicians. And then the last thing is, if you have a provider that is with another practice at the beginning of the year and they have a specific tax identification number and a value modifier payment is assessed on that particular tax identification number. When that provider leaves that practice and then joins your practice and now takes on your tax identification number, the value modifier adjustment does not follow the NPI. It's only associated with the tax identification number. So if a provider is with a practice that will be receiving a payment adjustment based on the value modifier, and that physician joins a new practice under a new tax identification number, he or she does not bring that penalty or the upward adjustment with them. So that's important to note that, again, the upward or downward adjustment does not follow the EP, but follows the tax identification number. The last slides that I have basically shows how to help providers determine when and how and if the value modifier applies to them for 2014. So the first slide that I have here is for groups of 2 through 9. And we've talked about groups of 2 through 9 and that they will be in the last phased-in approach of the value modifier program. So really for 2016, well, for 2016, which is the reporting period starts in 2014, they are not eligible for the value modifier program, but I did want to talk a little bit about their participation in PQRS. So did the eligible provider or group meet 2014 PQRS incentive criteria? If the answer is yes, then of course those providers will receive an additional 0.5% in their Medicare fee-for-service, and of course they avoid the PQRS payment adjustment. If the answer is no, then I would ask another question. Did the EP or group meet criteria to avoid the penalty? If the answer is yes, they reported and they had successful reporting just enough to avoid the penalty, then that's it. They just avoid the penalty. If the answer is no, then of course they would be subject to the 2016 PQRS payment adjustment of 2%. Again, they are not qualified for the value modifier program, but they will receive the penalty related on the PQRS. The second group that we would talk about are groups of 10 or more. And again, this participation starts in 2014 with PQRS reporting. So do you plan to report PQRS in 2014? So after everything we've talked about, I would hope that the answer would be yes. However, if you do not plan on reporting PQRS in 2014, again, all the eligible providers in the group will be subject to the 2016 PQRS payment adjustment of 2%. And in addition, the physicians in that group will be subject to the 2016 value modifier downward adjustment of 2%. If the answer is yes, you are participating, then my first question is, does the group plan to report to PQRS as a group? Yes. And will they report successfully? If they report successfully, then of course they'll receive a 0.5% payment incentive and avoid the penalty. If the answer is no, does the group plan to meet criteria to avoid the penalty? Then yes, they will avoid the penalty. If the answer is no, then we circle back around to the same. If they do not plan on meeting the criteria to avoid the penalty, then we go back to again being subject to both the PQRS penalty for eligible providers and physicians and the value modifier penalty for physicians. And then just lastly, remember physicians in groups of 10 to 99 are subject to upward or neutral value modifier adjustments only. They would not be subject to a downward adjustment because it is their first year of reporting value modifier. However, physicians in groups of 100 or more are subject to upward, neutral, or downward value modifier adjustment because this is their second year of reporting. And that concludes the presentation, and I would be happy to take any questions, and please feel free to take my email address if you have any questions that you would like to email me about value modifier as well as PQRS reporting. Thank you everyone for joining today, and I hope this information was helpful.